Hi, this is Dr. Nate coming from Proactive Healthcare. Today we're going to talk about chronic pain. For those of you who have chronic pain, I really don't need to describe this. You know, I have so many people coming in suffering from chronic pain. This makes up a big chunk of my patients are people that have been referred here because somebody got relief for chronic pain and they have had pain, tried everything, surgeries, pills, therapies, physical therapy, manipulations, everything. And we take a different approach because we don't always go at just the area of pain. We go, you know, to different areas that might be causing that pain too. But for those of you who are fortunate enough to not have chronic pain is any symptom or pain that just keeps coming back, maybe leaving, coming and going, or something that's been there for weeks, months, years. So, for example, if you go outside and rake the leaves or shovel the driveway, your low back might be sore the next day, but usually it goes away in a day or two. But if it's still there 2 weeks from now, a month from now, a year from now, then that's more of a chronic pain problem. Um, so, what you got to know first is that the brain is always wants to be safe. It's its number one job is to make sure you're safe, the environment's safe, your activity's safe. So we got what's called the threat neural matrix. It's where the brain will, if it feels threatened, it will give off symptoms. It will give off pain as an output. So people have probably told you maybe that, your pain is all in your head. Well, it comes across kind of mean or arrogant or like they're not listening to you or they think you're making it up, but literally pain is processed in the head. So they're right that way, but a lot of times the way they tell you comes across as mean. But the good thing is you can use your brain to turn off pain, especially chronic pain, by doing different activities or stimulating different parts of the brain. And that's what we're going to talk about today. So in my book, pain is anything that stops you from doing what you want. So, if exercising or being active makes you tired, sore, fatigued, and you stop being active or stop exercising because you're scared you're going to be sore afterwards, that would be pain in my book. If you stop playing catch or throwing a football because you're scared your shoulder's going to hurt afterwards, I consider that pain too. So anything you wish you could do, because we want to make your life better, we want you to enjoy the quality of life. So anything you stop doing or enjoying because you're scared of pain or because of some sort of symptom you might have afterwards, that's what we want to fix or help you with. And that's what we consider pain and trying to get rid of. One thing, we're not going to go into it a lot today, but neurotags. This is something where the brain is always processing stimulation, always remembers stimulation. So if you've ever hurt yourself doing something or it's been able to get your attention by giving you pain in a certain area, it will continue to do that. And that's what kind of leads to chronic pain. The research is showing us. So if, somehow, every time you do something that stresses your brain out, and then you get low back afterwards, that could be a neurotag. Maybe the problem isn't in your low back, maybe it's just your brain's way of telling you it doesn't like what you're doing or wants you to stop what you're doing or slow down or change something. So pain a lot of times is your brain indicating that it needs a change, and neurotags are your brain's way of creating these habitual patterns that reoccur and kind of make our lives very unhealthy and unhappy. All right, we're going to talk about breathing. That's the main focus of this video here. Breathing, probably never thought about it much. You started breathing when they slapped your butt when you came out and never thought about it since. But we're going to think about it today and we're going to test it. Breathing, the main goal of breathing is to give you optimal levels of oxygen. Your brain, your tissue, your cells, everything needs oxygen. If you suffer with neuropathy, you know what happens when tissues and cells don't get enough oxygen. How I explain it to a lot of my diabetic patients is, diabetes, too much sugar in the blood. Sugar makes things sticky, it's slow, so your blood moves slower. So if your blood is getting oxygen from your heart and lungs, the furthest way away from your heart and lungs is your fingers or your toes. So by the time the blood, if it's moving slower, gets there, all the oxygen molecules have been sucked by other tissues and cells. So by the time it gets down to the nerve endings in your fingers and toes, there's not enough oxygen to survive or make those nerves survive and thrive down there, so they start to die or degenerate. And that's where you get the sharp tingling feeling in the fingertips. The second thing that oxygen or the breathing does is make sure that you have adequate CO2 levels or carbon dioxide levels. So most of you probably think carbon dioxide is bad because we're getting rid of it, but our body actually needs to maintain a certain percentage of oxygen and carbon dioxide. So, as oxygen moves along, then it turns into carbon dioxide as it goes through the veins. Our brain, I was always constantly monitoring the levels of carbon dioxide. And so if it gets too low, there's a part of your pons in your midbrain that tells your body or tells your system to start to inhale or take in more oxygen. And sometimes you shouldn't be taking in more oxygen, but your brain thinks you need it because you have low levels of carbon dioxide. And this is usually caused by hyperventilating or breathing in too much and not having a good rhythmic pattern of breathing. We're going to talk about that and show you how to check that. The third part is having optimal pH. So breathing helps your body control its pH level. If you've ever had cancer or done research on cancer, you realize that cancer cells usually grow in acidic environments. So areas of the body where it's not getting enough oxygen becomes acidic, and that's when the cells start to change or deform or mutate into trying to survive in an inoxygenated area or acidic area. And so that's when bad things like tumors and cancer cells develop. And if our lymph system's not working well, our body's not functioning well, it doesn't identify these cells and kill them off, and then they multiply and grow, and that's not good. All right, respiratory. Here is a list of signs that you might have poor breathing patterns. Some of these you might make sense to you and others might not, but excessive neck tension is a big one that I see, low back tension, rounding of the shoulders, forward head carriage. Another big thing I'm seeing is cold hands and feet. So, especially with COVID, when it's damaged the lung tissue, as your lungs are still damaged, a lot of times your oxygen levels go down and people suffer with cold hands, cold feet. This list over here is, common with people that are chronically having breathing disorders. So shortness of breath, sweating, dizziness, slurred speech, again, cold, tingling, numb hands and feet. Another big thing is kind of mental health stuff like anxiety or depression or brain fog or impaired memory, concentration, confusion, even difficulty swallowing and throat conditions, blurred vision, visual stuff is all common with breathing disorders too. So big long list there. This is why we're doing this talk here, to make you aware that maybe breathing could be a solution to some of these symptoms that you're suffering from them. Below here should be a way to download this questionnaire. Otherwise, you can look it up online. But take time after you watch this video and just kind of fill in this questionnaire. First one's chest pain. If you never have chest pain, put 0, rarely, sometimes, often, very often. So it goes from 0 to 4. And then just go down the line, add them all up. And if your score is over 23, there's good indication that you're a hyperventilator, which then leads to a lot of those symptoms that we just went over there. So this is a questionnaire I have a lot of my patients do. It's easy to find online. I'll put a link there so you can open it up and look for that. All right, so we're going to get to our first test here on breathing. So one of the simplest tests that I have almost all my patients do is just see how long they can inhale for. So I don't want to see how fast they can inhale or how hard they can inhale. I just want you to go and do it as long as you can before your brain says, oh, I got to exhale. So we're going to do this, again, take your time. We want to see how long you can do it. We're not going to do the exhale. That's the second part of this test, but we're just going to do inhale. So I'm going to set a timer for a minute here. We probably won't even go that long, but I'm going to hit start. So I'm going to go 3, 2, 1, start. And when I say start, just start an inhale as long as you can. And then pay attention to how long it is. Write it down here, and we'll talk about it in a second here. Ready? So 3, 2, 1, start. 5 seconds, 10 seconds, 15 seconds, 20 seconds, 25 seconds, 30 seconds, 35 seconds. All right. If you can keep going, you're doing great. What I find with almost a ton of my patients, maybe even 7 out of 10, 8 out of 10, can do less than 10 seconds. A lot of them 5 seconds or less. They start up, and after 5 seconds, I have them use a stopwatch and they time it, and their lungs just can't expand. They can't inhale that air. For some reason, their brain feels threatened after 5 seconds, 10 seconds, and that's not good. I mean, as an athlete, we want, on average, we want people to be at least 15 seconds here. So if you didn't do 15 seconds, we need to work on that. If you're an athlete, we got to get that up 20, 25, 30 seconds, even more, so that it helps with your endurance, helps with you not get fatigued with your sports. So let's show you some ways, other ways you can test this, maybe why you only had 5 seconds or 10 seconds or less than 15. The first one is maybe you're a chest breather, and this is pretty common. So an easy test is to do the high-low test. So you just put one hand on your chest, one hand on your stomach, and just just breathe in normal, maybe a little bit more of an inhale or an exhale that you normally do, but just test as you breathe in and out, see which hand is moving. Ideally, when you breathe in, your diaphragm should push out. So you got a diaphragm that sits right underneath your lungs. It's like a big umbrella looking thing. And so when you breathe in, it relaxes or droops down so your lungs can expand. And then when you breathe out, it pushes up and contracts and pushes out your air. And so when you breathe in through your nose, your abdominal or tummy should come out. And then when you breathe out, it should go in. But what I find with a lot of people is they're chest breathers. So when they breathe in, their shoulders go up, their chest goes up, especially if I ask them to breathe a little bit deeper than they normally do. Get this big, like that. And that's not good. That's not what we want. So the test can end up turning into the therapy. So just, a few times a day, just breathe in through your nose and have your stomach expand out, and then breathe out and have your stomach come in. So that's the first test. The next test you usually need somebody to help you with. It's called the rhythmic excursion test. You basically have somebody put their hands on the bottom of your rib cage. So these two fingers are probably on the last two ribs. Your thumb should be just off the spine, and have somebody take a deep breath in, and just not a super deep breath, but a little bit more than normal, and just watch their lungs, or watch the movement of your fingers. Normally your thumb should separate equally, about 3 inches in each opposite direction. But what I find with a lot of people is one side moves, the other side doesn't move at all, or maybe a little bit, but it's not the 3 inches that it's supposed to move. And most times it's the left side, if you're a right-handed person, doesn't move as well as the right side. And this is not normal. We want to check it on 3 different levels. So I always look at a person and divide them in half and say, okay, you got a right lung and you got a left lung. And then I take that lung and divide it into 3 parts. I got a lower lung, middle lung, and upper lung there. And so as you breathe, both lungs and all 3 levels on both sides should be moving. And when it doesn't, then you're not getting the same breathing, rhythmic breathing that you should. And so I'm going to show you some exercises for that. So we've got 2 exercises for that to increase both lung capacities on both sides and at the 3 different levels. The first one is called the lateral opener stair-step breathing. So it's not a balance treatment. So find a wall. This guy's putting his right arm on the wall. What he's going to do is put his left leg behind. So it's a lateral, it's so it's stretching this lateral fascia here. And then you can either do it by yourself or with a partner. So if you have a partner, they're going to put their hand at the bottom of your lungs or at the bottom of the rib cage, and you're going to take some nice deep breaths in and feel pressure. I know this sounds kind of weird, but you should be able to inhale and expand your lung on the 3 different levels. So we're going to start with the lower. You're going to push your lung out against that hand as you breathe in. Do that 3 to 5 times. Then you're going to have them move the hand up to the middle of the rib cage and do the same thing. Have them expand and feel that hand spread out or push away from the body. And then the third part is the upper. So they can kind of cup the shoulder or go deep into the armpit in the front there and take and breathe up and feel that expansion in there. And if you don't have a partner and you can do this at home, I mean, most of my patients, we give TheraBands or exercise bands, wrap that around and do the same thing and just feel the band expand. So if you have the band up here, breathe in and feel that band, push that band out against your lung tissues or against your side of your ribs there and work your way up. Easy to do, 3 to 5 breaths each level, and then flip over and do the other side of the lungs. And then go to the next level is, they call it the front opener, because now we're going to take that leg that's closest to the wall and put it behind, and then we're going to keep the same arm up, and now we're going to do the same thing. We're going to start with the lower lung, take 3 to 5 breaths, then we're going to take the middle lung and then the upper lung and do the same thing, and again flip over and do the other side there. So easy test, or easy first of all test to see if you're moving there and you can actually control your lung movement in all the different levels, but then easy exercise and rehab to strengthen those lungs, and then retest and see if you can start holding inhaling for longer than that 5 or 10 or 15 seconds that we first tested. All right, so here's a big test, another one, easy to do. It's called the BOLT test. It's a blood oxygen level test is what it stands for. They use this, a lot of therapists use this to determine, how your kind of a baseline of where your carbon dioxide levels are, your carbon dioxide level or health, and your pH balance. So it's not specific for those, but it gives a good indicator, and we'll go over that after we do the test here. This test is best done in the morning, right when you wake up. Get out of bed, take a few breaths, and then try this. The reason for that is because your lymphatic system's been clearing up your body all night long, so you should be fresh and healthy in the morning. Otherwise, you can do this anytime during the day. Just, we don't recommend you do it within 10 to 15 minutes after doing, activity or aerobic activity or exercising of any sort. So if you've been just sitting at your desk or sitting at home watching TV, then you can do this right away. Before we start, I'm going to set a timer for this one, but just start to breathe through your nose. So, take a nice normal breaths through your nose and then breathe out through your nose. So if you're normally a mouth breather, this is a little bit different, but you're just kind of training your brain, getting ready to do a breathing exercise or a breathing assessment, so it triggers your brain to start thinking about breathing. And then when I say go, and I'll set a timer here and we'll count down again like we did with that last test, I'm going to have you close your nose with your thumb and your forefinger, and then kind of like if we're jumping into a pool and you're having to hold your breath underwater. So that's a simple test. We're just going to breathe normal, relax, and then we're going to take a breath in, and then we're going to close off our nose and just hold our breath as long as we can. And I don't want you to, hold it so long that you gasp for air. So just hold it till your brain says enough is enough, and then write down that number. So again, I'm going to set my timer here. Set it. All right, so I'm going to say 3, 2, 1, go. And I'll just start. If you can't see the timer, I'm going to say 5 seconds, 10 seconds, 15. And just pay attention. When you have to, grab some air, see what number we're at. All ready? So 3, 2, 1, go. 5 seconds. 10 seconds. 15 seconds. 20 seconds. 25 seconds. 30 seconds. 35 seconds. 40 seconds. 45 seconds. 50 seconds. 55 seconds. And 1 minute. All right. How'd you guys all do? All right. Well, let's talk about it. Don't get discouraged yet if you couldn't do it very long. You can always try it again. Let's go over what the numbers mean, what the tests mean. So they've done a lot of studies on this, and this is kind of how they break it down. if you had 5 to 10 seconds, they find that it's really not good. I mean, that's a struggle. You probably realize that when you have to get, you think you could probably hold your breath longer than that. But that's they find a lot of diseases fall in that. So people that can only hold their breath like 20 seconds or less is kind of the disease range for a lot of chronic diseases, which also chronic pain can fall in there. So they kind of break it down. 10 seconds or less is severe lack of oxygen, that the body's craving oxygen around. Usually people have systemic inflammation, so a lot of joint pain, joint inflammation. They have poor cellular environment, so cells are dying prematurely or not functioning the way they should. So, if you had 10 seconds or less, don't get discouraged, but, be aware we really want to work on it if you want to get healthier. Now if we bump up to 20 seconds, this is a lot of disorders like asthma, emphysema, and chronic hyperventilation. Remember that list of things I said that come when you have chronic breathing problems? Well, that's like chronic hyperventilation list. So chronic neck pain, low back pain, brain fog, sweating, throat stuff, all that stuff. You can go back and look at that list. And, if you can't hold your breath more than 20 seconds, that could be the cause of a lot of those symptoms. The average person that exercises should be in that, that they find is between 20 and 40, but our goal should be 40 or more. So that's where you start to have, find a healthier people range in there is, 60 seconds, 40 to 60 seconds in there. But the good thing is if you can raise, if you can work on this with some of the stuff we talked about, if you can raise your points by 5, your Bolt score by 5, it drastically improves your brain function, your body performance, helps people with autoimmune disease symptoms, chronic pain, and helps get rid of free radicals. So that's the encouraging thing if you got a low score here. So don't be discouraged too much yet. But what I would do, with you, I would work on this for 8 to 12 weeks, trying to get that Bolt score high. You don't have to test it every single day, but periodically during that 8 to 12 weeks, you need to practice in little spurts. I mean, I would practice it, a couple of times a day, do some breathing exercises for just, a minute or two, maybe 3 minutes at the most. Easy things you can do is diaphragm stretches, what we'll talk about in part 2 of the chronic pain video here or in some of my other videos. You can do the lateral and front openers that we talked about, standing on the wall with your arm up and doing the different levels of breathing. You can just hold your breath. That will work it. So breathe in through your nose, hold it. Box breathing is part of that, where we breathe in through the nose for 2 to 4 seconds. Hold it for 2 to 4, and then breathe out for 4 seconds. And that's a way to put you into parasympathetic or relax you if you're in a stress state. We use things like the relaxator. I'll probably have a link for that down there. You can get those online or at our office. They're like adult pacifiers. You put them in your mouth and they make it harder to exhale. So you can breathe in through your nose. So they teach you how to breathe in through your nose if you're a mouth breather. And then when you breathe out, it kind of restricts the blood flow. So it improves your diaphragm muscles and your lung capacity. And in other videos, we'll look at cranial nerves. Cranial nerves 9 and 10 can also help improve your breathing patterns there too. So why it's concerning having a low Bolt score besides some of that stuff I talked about, but bottom line, it can give you some poor brain function. So if you're having brain fog or if you're concerned about losing brain cells or concentration or mental capacity, we should work on your Bolt score. Circulation, like I said, you need a balance of that carbon dioxide and oxygen levels, helps with the smooth muscles and relaxes the airways and capillaries in different blood vessels. So poor circulation is a factor. And also affects energy levels. So your Krebs cycle, which produces all your ATPs, is affected by poor breathing techniques or poor breathing, practices. So if we can increase your energy levels and help you perform better, if we can help you, be able to inhale more and be able to hold your breath longer and be able to use both sides of your lungs and your lower, middle, and upper part of your lungs too. So hopefully you got some good information from this. Hopefully it's opens up your eyes a little bit if you scored low on an inhale test or you're a chest breather or or the BOLT score. So if you like this video, please like us, subscribe to our channel, and then look forward to part 2 of chronic pain video. We'll give you some more ideas on how to get rid of chronic pain. Thanks and have a great day.